Have you ever noticed that something that was once filled with a deep sense of comfort and a beautiful feeling of closeness, the experience of intimacy, now feels uncomfortable, or perhaps even painful, in the years after menopause? If so, I want you to know with absolute certainty that you are far, far from alone. A great many women navigating their 50s, 60s, and the decades beyond silently experience pain during intimacy. Some come to believe that it is simply an inevitable and non-negotiable part of the aging process. Others quietly and sadly begin to avoid closeness altogether, feeling worried that their partners will not be able to understand what they are going through. But here is the profound and empowering truth that I so deeply want you to hear today. Intimacy pain after menopause is not inevitable, and in a great many cases, it is being made significantly worse by a series of common and completely avoidable mistakes. By taking the time to learn what those mistakes are, and by taking the courageous and proactive steps to correct them, you can absolutely restore both your physical comfort and your emotional connection. Hello, I am Dr. Lily Stone. For more than 3 decades, I have had the immense privilege of caring for women through every single stage of their lives, from the vibrant childbearing years, through the profound transition of menopause, and well into the decades beyond. I have seen firsthand how the pervasive silence that surrounds the topic of intimacy issues can leave women feeling isolated and alone. And I have also witnessed how the power of knowledge can completely transform that silence into a sense of profound relief and unwavering hope. My mission here with you today is to help you to recognize 5 of the most common mistakes that so often serve to worsen intimacy pain in the years after menopause. By understanding what they are, you will be far better equipped to protect your health, to preserve your confidence, and to nurture your most important and cherished relationships. Before we begin, I would be so honored if you would subscribe to this channel. At Elderwear Wellness, we are committed to bringing you evidence-based, compassionate health guidance that is specifically tailored for the unique needs of women over 50. If you have ever wondered whether the intimacy pain you are experiencing is just normal, or if you have struggled in silence with this issue, I warmly invite you to share your thoughts in the comments section below. You might be surprised to discover just how many other women are feeling the exact same way, and your voice could be the very thing that encourages another woman to finally seek the help that she so deeply deserves. So, let's dive into the very first, and perhaps most foundational, mistake: ignoring vaginal dryness. After the onset of menopause, your body begins to produce significantly less estrogen, the primary hormone that is responsible for keeping your vaginal tissue thick, wonderfully elastic, and naturally lubricated. Without this consistent supply of estrogen, the delicate walls of the vagina can become thinner, more fragile, and persistently dry. This condition is known medically as vaginal atrophy, or more recently, as genitourinary syndrome of menopause, GSM. According to both the Mayo Clinic and the North American Menopause Society, vaginal dryness stands as one of the most common and direct causes of intimacy pain in post-menopausal women. And yet, it is also one of the most frequently overlooked and untreated conditions. A great many women tend to dismiss it as a simple nuisance, or they come to believe that there is absolutely nothing that can be done about it. That silence, unfortunately, allows the problem to progressively worsen over time. You can think of the role of estrogen in your body as being like the oil in a well-functioning machine. When all of the gears are well oiled, they are able to glide smoothly and effortlessly against one another. But when that essential oil begins to run dry, the gears will inevitably begin to grind and to scrape, which causes a great deal of friction and potential damage. That is exactly what happens on a microscopic level inside your body when your estrogen levels fall. The act of intimacy without sufficient lubrication turns into a source of painful friction instead of a source of comfort and connection. Over time, the act of ignoring this dryness does not just make the experience of intimacy painful, it can also lead to the development of small but painful tears in the vaginal tissue, to an increased risk of infections, and even to a profound loss of desire simply because the association of pain has completely replaced the experience of pleasure. I vividly recall one of my dear patients, Margaret, who had been avoiding intimacy with her husband for nearly 2 full years. She shared with me that she felt deeply embarrassed and had come to believe that painful intimacy was simply her new normal. When she finally found the courage to speak up about it, she was genuinely shocked to learn that a variety of simple and effective solutions already existed. The consistent use of the counter-vaginal moisturizers helped her to restore a sense of comfort on a day-to-day basis. The use of high-quality, water-based lubricants made the experience of intimacy so much gentler for her, and with the help of a low-dose vaginal estrogen therapy, her delicate tissues were able to regain a significant amount of their elasticity within just a matter of weeks. Margaret later told me, her voice filled with a mixture of relief and regret. "I just wish that I hadn't waited so long to ask for help." Another one of my patients, Ellen, shared a very similar story with me. She had begun to notice a persistent sense of dryness and discomfort, but she had not mentioned it to anyone for fear that her partner would think that she had lost all of her interest in him. In reality, her interest in him had not disappeared at all. It was only her physical comfort that had. By bringing her partner into the conversation and by seeking out the appropriate medical help, Ellen was not only able to significantly reduce her pain, but she was also able to strengthen the sense of trust and of intimacy within her marriage. Her powerful experience serves as a poignant reminder to all of us that the act of ignoring our dryness does not just affect our bodies. It can also create a profound and painful sense of emotional distance in our most important relationships. The available data serves to reinforce this point. According to a comprehensive study that was published in the prestigious Journal of the American Medical Association, JAMA, nearly half of all post-menopausal women report experiencing the symptoms of vaginal dryness. And yet, fewer than 1/3 of them ever seek out any form of treatment. That means that literally millions of women are suffering completely and totally unnecessarily. The wonderfully good news is that the available treatment options are both incredibly safe and highly effective. Vaginal moisturizers, a wide variety of lubricants, and a number of different prescription therapies can all be instrumental in helping you to restore your comfort. The mistake is not in having the dryness, it is in staying silent about it, in convincing yourself that nothing can possibly help, or in feeling too embarrassed to be able to ask for the solutions that are so readily available. Here is the one and most important message that I want you to remember from this section. Vaginal dryness after the onset of menopause is incredibly common, but it is not something that you simply have to endure. The act of ignoring it will only allow the intimacy pain to grow progressively worse, while the courageous act of acknowledging it will open the door to a profound sense of relief and of renewal. Just as you would never choose to ignore a loud and squeaky wheel in your car, because you know that it is a clear and direct signal of a source of friction, you should not choose to ignore the symptom of dryness in your own body. I urge you to address it, to treat it, and to give yourself the precious and beautiful permission to be able to rediscover a sense of closeness with your partner, completely and totally without any pain. Once we have had the opportunity to address the very first mistake of ignoring our vaginal dryness, the second and equally important mistake is one that flows quite naturally from it: avoiding conversations about pain. Far too many of the women that I have worked with over the years have expressed that they feel a great deal of embarrassment, of shame, or of fear when it comes to the topic of talking about their experience of intimacy after the onset of menopause. Some of them choose to stay completely silent with their partners, as they are so worried that they will be judged or that they will be misunderstood. Others choose to stay completely silent with their doctors, as they are so afraid that they will be brushed off or that they will be told that what they are experiencing is just a normal part of the aging process. This particular kind of a silence, however, is not in any way protective. It is, in fact, incredibly harmful. When you make the decision to avoid talking about your pain, you are allowing it to be able to grow, both on a physical level and on an emotional one as well. The esteemed American College of Obstetricians and Gynecologists, a COG, has so often and so strongly stressed the fact that having an open and an honest form of a communication is absolutely and completely essential for the purpose of being able to successfully address the issue of a post-menopausal intimacy pain. The experience of a pain during the act of an intercourse, which is known medically as dyspareunia, can be a condition that is able to stem from a wide variety of multiple causes. It can be caused by the significant and the profound changes in our hormones, by the thinning of our tissues, by a reduction in the flow of our blood to the area, or even by a sense of an anxiety that is so closely and so directly linked to the very anticipation of the pain itself. By choosing to keep quiet about what you are experiencing, you are effectively depriving yourself of the kind of a medical guidance that could be able to pinpoint the exact cause of your pain, and that could be able to provide you with an effective and a lasting form of a treatment. The act of your silence is also able to deprive your partner of the precious and the beautiful opportunity to be able to understand what you are going through and to be able to support you in the process. Imagine for a moment that you are having to carry a very heavy and a very cumbersome suitcase up a very long and a very steep flight of stairs. If you were to never tell anyone just how heavy that particular and that important suitcase is, then no one would ever be able to offer to help you with it. But the very moment that you are able to speak up and to ask for some help, others are then able to step in and to be able to lighten your load. The experience of an intimacy pain is able to work in the very same and the very exact way. When you are able to name it, you are able to give your doctor the precious and the beautiful opportunity to be able to recommend a variety of solutions, and you are able to give your partner the precious and the beautiful opportunity to be able to walk beside you in the process, instead of them having to leave you to be able to struggle with it all on your own. I am often reminded of a patient of mine named Diane, who had had to endure so many years of a painful and an uncomfortable intimacy without ever having to say a single and an individual word about it. She had been so worried that her husband would be able to feel as if he was being rejected, so she had made the decision to just quietly and silently withdraw from him. Over the course of time, her marriage had grown so very distant, not because the love that they had once shared had gone away, but because the silence between them had begun to build some very high and some very painful walls between them. When she had finally been able to break her silence in the safety and the comfort of my office, she had cried with a profound and a beautiful sense of a relief, with the help of a treatment and of some honest and some compassionate conversations at home. She and her husband had been able to slowly and gently rebuild their sense of their closeness with one another. Diane had later told me that the act of her having to talk about it had been so much scarier for her than the pain itself, but that it had been the only and the one way in which they had been able to find their own and their personal sense of their healing. It is so very important for you to be able to remember that the role of your physician is not to be able to judge you, but it is to be able to support you. According to the esteemed North American Menopause Society, up to 75% of all of the women who are in the post-menopausal stage of their lives will be able to experience a variety of genitourinary changes that are able to affect their experience of their intimacy. You are not at all unusual in this regard, and you are most certainly not alone. By being able to voice your concerns, you are able to join the millions and the millions of other women who are in the process of breaking the silence and of reclaiming a sense of a control over their own and their personal health. The doctors of today are able to have so many more tools than they have ever had before, from a wide variety of lubricants and of estrogen therapies to a variety of counseling and of pelvic floor therapy services. But none of these wonderful and these profound solutions can ever be able to reach you if you are choosing to remain quiet about what you are experiencing. Our partners are also able to play a very crucial and a very important role in this regard. When our experience of our intimacy pain is being hidden from them, Our partners may so often begin to misinterpret our withdrawal as being a sign of a lack of a love or of an attraction. But when you are able to open the door to a conversation, you are able to allow a sense of a compassion to be able to enter into the space between you. A great many of the couples that I have worked with over the years have been able to find that the simple and the courageous act of just naming the problem is able to be a factor that is able to relieve a great deal of attention, to be able to reduce a sense of a guilt, and to be able to build a sense of a teamwork between them. It is able to reframe the experience of their intimacy from being a source of a fear into being a shared and a beautiful journey of their healing. The act of our silence, on the other hand, is only able to work to deepen the divide between us. So, here is the one and the most important lesson of our mistake number 2. Please do not suffer in a state of a silence. The experience of a pain is not something that you should ever have to be ashamed of. It is your body's own and intelligent way of being able to ask for some help. The act of your speaking openly about it, whether it is with your doctor or with your partner, is not a sign of a weakness. It is a sign of a courage. By being able to break the silence, you are able to give yourself the precious and the beautiful chance to be able to be heard, to be able to be helped, and to be able to be healed. In the years after the onset of menopause, when the experience of our intimacy begins to hurt, a great many of the women that I have worked with over the years will make the very understandable and the very logical choice to be able to avoid it altogether. At first, this might even feel like some kind of a solution. If I am able to stop, then the pain will be able to stop as well. But this particular and this important choice can actually become a third and a very significant mistake, because the act of our completely and our totally withdrawing from our intimacy will so often be a factor that is able to make the pain so much worse over the course of time. Here is the reason why. Our bodies are so wonderfully and so beautifully designed to be able to respond to a use. Just as our muscles are able to grow so much stronger with a regular and a consistent form of an exercise, the delicate and the precious tissues of our vagina and of our pelvic floor are able to stay so much healthier with a regular and a consistent flow of our blood, with a gentle and a consistent form of a stretching, and with a regular and a consistent form of an activity. According to the esteemed National Institutes of Health, NIH, the practice of a regular and a consistent sexual activity, or even of a non-penetrative form of an intimacy that is able to bring about a state of an arousal, is able to work to improve the circulation of the blood to the tissues of our vagina. That particular and that important circulation is able to be instrumental in helping us to be able to maintain the thickness, the elasticity, and the lubrication of these particular and these important tissues. When our intimacy is able to stop altogether, those particular and those important tissues may begin to become even so much thinner and so much drier, a factor that is able to make the pain so much more severe. If and when our intimacy is ever able to resume, you can think of it as being like a doorway that has not been opened in so many years. The hinges are able to grow so rusty, the wood is able to stiffen, and when you are finally able to try to push it open, it is able to resist you. In the very same and the very exact way, the tissues of our vagina that are never being engaged are able to gradually and progressively lose their flexibility. What had once started out as just a mild and a seemingly insignificant state of a discomfort can, over the course of so many months or of so many years of an avoidance, be able to turn into a very significant and a very painful state of a pain. I am often reminded of a patient of mine named Linda, who had made the decision to stop all of her intimacy after she had gone through her menopause, because of the feelings of a dryness and of a burning that she had been experiencing. She had loved her husband so very deeply, but she had so very much dreaded the experience of her discomfort. Years later, when she had finally been able to make the courageous and the beautiful decision to be able to seek some help for herself, the atrophy of her tissues had progressed so very much that her treatment had required so much more of a time and of an effort. With a great deal of a patience, of a therapy, and of a support, she had been able to improve. But she had later had to say to me, I so wish that I had not waited for so long. I had thought that the act of my avoiding the sex would be able to protect me, but it had actually been able to make everything so much worse. Now, this does not mean that you have to push yourself into any kind of a painful and an uncomfortable experience. The solution is not for you to have to grit your teeth and to have to endure. Instead, it is about the act of your having to explore some gentle and some gradual ways of being able to maintain a sense of a connection with your partner. Whether that is with the use of a variety of lubricants, of a variety of moisturizers, of a low dose of a vaginal estrogen, or of a simply and a beautiful non-penetrative form of an intimacy that is able to allow a state of an arousal to be able to stimulate the flow of your blood in a natural and a beautiful way. Even the act of a self-stimulation is able to play a very important and a very significant role in the process of being able to keep our tissues in a responsive and a healthy state. The esteemed Mayo Clinic has so often and so strongly emphasized the fact that the experience of an intimacy in any and in every form, whether it is a shared one or a solo one, can be a factor that is able to be instrumental in helping us to be able to maintain the health of our vagina in the years after the onset of our menopause. It is also so very important for us to be able to remember that the experience of our intimacy is not just a physical one. The experiences of an emotional connection, of a touch, and of a closeness are all a part of the overall and the comprehensive experience. A great many of the women and of the couples that I have worked with over the years have been able to find that the act of their broadening their definition of their intimacy is able to work to reduce the pressure that they are feeling and to be able to restore a sense of their confidence. By being able to stay engaged, even in some very small and in some non-painful ways, you are able to work to prevent the cycle of an avoidance and of a worsening state of a pain. So, the key and the most important lesson of our mistake number 3 is this one. The act of our having to stop our intimacy completely and totally may be able to feel like a form of a protection, but it will so often be a factor that is able to create so much more of a harm than of a healing. By being able to stay gently and beautifully connected, by being able to explore some new and some exciting approaches, and by being able to seek a medical and a professional support when it is needed, you are able to work to protect not only your physical health, but also the emotional and the beautiful bond that your intimacy is able to bring to your life. By now, we have had the wonderful and the profound opportunity to be able to cover 3 of the most common and the most significant of all of the mistakes that of an ignoring of our dryness, of an avoiding of our conversations, and of a withdrawing from our intimacy altogether. The 4th and the very important mistake may be able to surprise you, because it is one that is so often able to come from a place of a good and a pure intention, that of a relying only on the use of a variety of the counter lubricants, without ever having to seek a medical and a professional help. A great many of the women that I have worked with over the years, when they are being faced with the issue of an intimacy pain, will so often head to the drugstore aisle and will be able to purchase a lubricant. And while it is certainly true that the various and the sundry lubricants can certainly be able to help, they are so often just a temporary and a fleeting fix, rather than being a long-term and a lasting solution. According to the esteemed Mayo Clinic, the various and the sundry lubricants are able to provide a short-term and a fleeting sense of a comfort, but they are not able to be a factor that is able to address the underlying and the fundamental hormonal changes that are able to cause a state of a vaginal atrophy in the years after the onset of our menopause. The various and the sundry moisturizers, in a similar and in a comparable way, are able to be a factor that is able to improve our day-to-day and our regular sense of our dryness, but they are not able to be a factor that is able to restore the elasticity or the thickness to our tissues. You can think of it as being like the act of our having to put a lotion on a cracked and a broken sidewalk. It may be able to smooth the surface for a brief and a fleeting moment, but it is not able to be a factor that is able to repair the cracks that are lying just beneath it. The condition of a vaginal atrophy is one that is able to require a deeper and a more comprehensive form of a support, something that is able to penetrate and to be able to rebuild the tissue itself. Without having a medical and a professional guidance, you may be able to be treating the surface of the problem without ever having to heal its root. I can once remember having to treat a patient of mine named Joanne, who had been using a variety of lubricants so faithfully for so many years. She had kept on buying a variety of new and of different brands, as she had been so hoping that one of them would finally be able to take her pain away. Some of them had been able to help her just a little bit, but the experience of her discomfort had always and completely been able to return. By the time that she had been able to come in to see me, she had so completely and so totally resigned herself to the belief that the experience of a pain was just her permanent and her non-negotiable reality. With a simple and a straightforward prescription for a low dose of a vaginal estrogen, and with some education on the use of a daily and of a regular vaginal moisturizer, Joanne had been able to experience a dramatic and a profound improvement in her condition. She had later had to say to me, "I so wish that I had been able to know this 10 years ago. I had thought that I was doing all that I could." The various and the sundry scientific research is able to support this. A scientific study that had been published in the esteemed Journal of Menopause had found that the women who had only been using a variety of lubricants had been able to report a limited and a fleeting sense of a relief, in comparison to those who had been able to combine them with a variety of medical and of professional therapies, such as a local and a topical form of an estrogen. The difference had not just been a physical and a tangible one of a comfort, but it had also been an emotional and a profound one of a well-being. When the experience of their intimacy had become so much less painful, the women had been able to report an improved and a more positive state of their mood, a greater and a more profound sense of their confidence, and a stronger and a more beautiful sense of their relationships. This particular and this important mistake is a very understandable and a very logical one. A great many of the women that I have worked with over the years will so often hesitate to be able to seek a medical and a professional care because they are so often so very afraid of a judgment, of a cost, or of the side effects of a variety of hormone therapies. But the profound and the beautiful truth of the matter is that the options that are available to us today are so much safer and so much more personalized than they have ever been before. A low dose of a vaginal estrogen is able to work to deliver the medication directly and precisely to the tissues, with a minimal and a seemingly insignificant amount of an absorption into the bloodstream. A variety of non-hormonal options, such as a DHEA or a laser therapy, are also in the process of emerging. Without being able to speak to your doctor, you may be able to miss out on a variety of solutions that could be able to completely and totally transform your own and your personal experience. Here is a very important and a very critical reflection for you to be able to consider. The act of your having to use a variety of lubricants alone is not in any way wrong, but the act of your having to stop there is. The experience of a painful and an uncomfortable intimacy in the years after the onset of our menopause is a medical and a professional issue, and not just a personal and an insignificant inconvenience. By being able to talk to your physician about it, you are able to open the door to a variety of treatments that are not just able to mask the symptoms, but that are also able to actually and effectively heal the tissues and to be able to restore a sense of a comfort for the long term. So, the key and the most important takeaway from our mistake number 4 is this one. Please do not settle for any kind of a surface and a superficial solution when a deeper and a more comprehensive form of a healing is so very much possible for you. The various and the sundry lubricants and the various and the sundry moisturizers are all very valuable and very important tools, but they should always and completely be a part of a larger and a more comprehensive plan that is being guided by a medical and a professional advice. By being able to seek some help for yourself, you are able to honor your body's own and its personal needs, and you are able to give yourself the precious and the beautiful chance to be able to move from a state of a coping with your pain to a state of a truly and a completely reclaiming your intimacy. The fifth and perhaps the most damaging and the most insidious of all of the mistakes is the act of our having to believe that the experience of a pain in the years after the onset of our menopause is simply and completely our new and our non-negotiable normal. All too often, the women that I have worked with over the years will so often tell themselves that this is just the way that their life is now, and they will so often resign themselves to a life of a living with a discomfort. This particular and this important mindset is able to steal our joy, to be able to erode our confidence, and to be able to quietly and insidiously harm our relationships. And most importantly of all, it is not in any way true. The esteemed National Institutes of Health, NIH, and the esteemed North American Menopause Society have both so often and so strongly emphasized the fact that the experience of a painful and an uncomfortable intimacy in the years after the onset of our menopause is a very treatable and a very manageable condition. It is not in any way something that you have to accept as being the cost of your aging, when you are able to assume that the experience of your pain is an inevitable and a non-negotiable part of your future. You are effectively closing the door on a variety of solutions that could be able to restore your comfort and your closeness with a partner. It is like you are living with a pebble in your shoe. If you are able to tell yourself that you are not able to remove it, you will be able to keep on walking in a state of a pain, even though a sense of a relief is so very much possible for you. I am often reminded of one of my patients, a wonderful and a beautiful woman named Teresa, who had had to delay her act of her seeking a help for her condition for over a decade. By the time that she had been able to come in to see me, she had so completely and so totally convinced herself that the experience of an intimacy was permanently and non-negotiably off the table for her. Her marriage had grown so very distant, and she had had to carry with her a silent and a painful sense of a grief. When we had been able to start her treatment with a vaginal estrogen, and when we had been able to introduce a pelvic floor therapy into her routine, she had been so completely and so totally astonished at the difference that it had been able to make. She had cried and she had said to me, "I cannot believe that I had wasted 10 years of my life just thinking that nothing could ever be able to change." Her story is a very powerful and a very poignant reminder to all of us that the experience of a pain should never and completely be accepted as being our destiny. Now, let us now take a brief moment to be able to reflect on the 5 of the most common and the most significant of all of the mistakes that we have been able to cover together. 1. The act of our having to ignore our vaginal dryness. 2. The act of our having to avoid our conversations about our pain. 3. The act of our having to stop our intimacy altogether. 4. The act of our having to rely only on the use of a variety of lubricants without ever having to seek a medical and a professional guidance. And 5. The act of our having to believe that the experience of our pain is our new and our non-negotiable normal. Each and every one of these particular and these important mistakes is a very understandable and a very logical one. And if you have ever been able to make any of them, you are most certainly not alone. Millions and millions of women have been able to walk the very same and the very exact path. But the wonderful and the inherent beauty of our awareness is that it is able to allow us to be able to choose so very differently as we now begin to move forward. You do not have to accept a state of a discomfort as being a permanent and a non-negotiable part of your future. With a medical and a professional support, with some open and some honest conversations, and with a gentle and a consistent sense of a persistence, you are still completely and totally able to rediscover an experience of an intimacy that is not being defined by a pain, but that is being defined by a closeness, by a joy, and by a connection. Here is the wonderfully and the profoundly hopeful truth of the matter. Your body is so incredibly and so wonderfully resilient. Even in the years after the onset of your menopause, with the right and the proper sense of your care, your tissues are able to regain their elasticity, your comfort is able to return, and your relationships are able to flourish once again. The journey may be able to require a great deal of a courage and of a patience from you, but it is always and completely worth it for you to be able to take. You so deeply and so completely deserve to be able to have an experience of an intimacy that is completely and totally without any kind of a fear, and you so deeply and so completely deserve to be able to feel so whole and so confident in your own and in your beautiful skin. As we now bring our time together to a close, I would like to encourage you to be able to reflect on which of these 5 and these important and these significant mistakes was able to resonate with you the most. Have you ever been able to believe that the experience of your pain was an inevitable and a non-negotiable part of your future? Or have you ever felt so too embarrassed to be able to ask for some help? Please share your thoughts in the comments section below. Your story could be the very thing that is able to encourage another woman to be able to seek a medical and a professional care for herself. And if you have found this particular video to be a valuable and an important one, I would be so very grateful if you would please consider subscribing to this particular channel, and if you would share it with a friend. Together, we are able to break the silence, to be able to spread an awareness, and to be able to remind all of the women everywhere that the experience of a menopause may be able to bring about a variety of changes, but that the experience of a pain does not have to be one of them. Please remember, this particular and this important pain is not your new and your non-negotiable normal. A sense of a relief is so very much possible for you, and your intimacy can be reclaimed. And you, at every single and at every individual stage of your life, are so very worthy of a love, of a comfort, and of a joy.